please space the childbirths. That's very, very important. At least a 2 to 3 year gap between the siblings is ideal. Any form of contraception, please seek medical help. Whatever is suitable for you needs to be assessed on an individual basis. It is not oral contraceptive for all or barrier contraception for all. So many of my patients also ask, to put it in very simple and straight terms, whether birth control pills cause infertility. I would just say it's a myth. It's a disbelief.
Hi guys, this is Minidevan and you're watching TheHealthSite and India.com. Today we have with us Dr. Vasundara Jagannathan, Senior Fertility Specialist at Oaisis Fertility, Chennai. Hi doctor, how are you?
I'm good. Thanks for making me in the show. Good to see you all.
Same here, it's a pleasure for us. So to begin with, if you could share with us what exactly is World Contraception Day and what is its significance?
Yeah, so this World Contraception Day was first conceptualized in the year 2007, and it's celebrated all over the world on the 26th of September. The aim of this World Contraception Day is to improve the awareness of contraception, especially to the younger women and men, so that they are informed, they can take informed choices on different modalities of contraception available, and also they are enabled to take care of their sexual and reproductive health and also practice safe sexual measures.
Also, if you could tell our audiences, why is the awareness of contraceptives so important, and is the awareness as much as it should be?
So, considering this COVID-19 pandemic, I should bring in this very significant point. Is the last 2 years has been ups and downs in terms of lockdowns, and that has impacted this contraceptive measures and unplanned pregnancies which is happening. The reason being because of lockdown, there has been shutdown of family planning units and centers. There are a lot of unplanned pregnancies. Many women have been forced into marriages without even having proper counseling on adequate contraceptive measures, family planning measures. And also there has been a lot of gender-based violences, especially in the first 6 months of this lockdown period. This is one aspect where we really have to probably digitalize this platform, and so that these contraceptive measures are taken to even the rural India, and people are aware about the armamentarium of contraceptions available to them. One of the most important things is the availability of these contraceptive measures. By this I mean two things. One is affordability to the patients. The other is accessibility to the patients, and the third thing is also acceptability amongst the community. So these are all very, very important.
And since we are talking about the cost-effective measures, could you also share with our audiences the effective modern-day contraceptive methods?
So all of us should understand any form of contraception should be effective. The failure rate of that particular contraception should be minimal or negligible. Then only the contraceptive program kicks on to a success. So at the same time, we have to understand the cost involved behind all these contraceptive measures. So gone are those days when people were marking on their calendar the fertile days and avoiding those days, or practicing coitus interruptus to make it as a natural way for birth control, because these are all associated with high failure rates. So now then we have slowly evolved, and we have got various modern methods of contraception with very minimal failure rates. To mention a few, these are intrauterine progesterone containing devices, we call it LNG IUS, or copper containing devices, or called as copper T commonly. The other modern methods include certain implants which are placed under the skin in the upper portion of the arm, and some patches, contraceptive patches. There are some vaginal rings that are available, cervical cups. There are a lot of other forms, commonly used ones are barrier methods, though the failure rates are close to 17 to 18% when they use the barrier contraception. To put it in a nutshell, the most significant and most useful modern day contraception would be an intrauterine device, or a combined oral contraceptive pill. Again, what we have to address when we are talking about contraception is two areas. One is we need to control control and space the birthing, that is family planning, and also contraception. The second thing is also to prevent sexually transmitted diseases. So these are very, very important, because when we use an intrauterine device or a oral contraceptive pill as a method of contraception, they don't necessarily prevent the sexually transmitted diseases, for which an add-on barrier contraception is also advocated.
But since you mentioned one of the most significant is the contraceptive pill, so there has been lot of confusion, and there has been a lot of talks regarding the fact that does the pills have any side effects? So are there any side effects of contraceptive pills?
So, just for us to understand that there could be very minimal to mild side effects in certain group of people, and there are some category of people who are, high risk for developing problems, in whom we generally avoid contraceptive pills. So we categorize them even during the initial conversation with the patient. Now, there are certain common side effects, is something called as spotting or breakthrough bleeding. This usually happens by prolonged use of oral contraceptive pills, and that's not bothersome. We have measures to tackle that. The other things are mild headache, some bloating feeling, or heavy-headedness, breast tenderness, nauseating feeling, or some vomiting tendency, gastritis. So these are all very minimal side effects, and it doesn't happen with all women who use contraception. The other thing is, in certain women who are high risk for certain conditions, there could be chances of clotting problems or thrombosis, deep vein thrombosis. This is especially seen in obese women or women who smoke, or any history of previous thrombosis like events in the past. So we really take care and avoid contraceptive pills in these group of individuals, and also in patients who have had previous history of stroke or any cardiac problem, liver, gallbladder disease. We generally try and tend to avoid, or use a very mild dose oral contraceptive pills if they are deemed to be safe.
And since we are talking about birth control measures, doctor, could you also tell our audiences, does birth control in any way affect fertility?
So this is one of the common questions which many of my patients also ask. To put it in very simple and straight terms, whether birth control pills cause infertility, I would just say it's a myth. It's a disbelief. So there are no scientific data to prove that women who take birth control pills have infertility. They are at a similar chance to women who don't take birth control pills. So this is a total disbelief. What these oral contraceptive pills do is they just suppress your hormonal levels, thereby they suppress the ovulation. They don't allow the eggs to get released on a regular basis, on a monthly basis. And also they make the cervical mucus quite thick. And that is why they are hostile for the sperms to travel and reach the egg, fertilize, and result in a pregnancy. So when they are going to take this contraceptive pills for a few months or few years, and later if they want to start a family, once they stop the birth control pills, they are usually able to resume their fertility, regular ovulatory cycles, and their cervical mucus gets ready to accept the sperm and transport it to the egg, and thereby hasten fertilization for these couples.
Also, if you could share with the audiences what exactly is tubectomy, and if women can pursue fertility goals even after tubectomy.
So, tubectomy is a permanent method of sterilization. Now, that means there are different modes of sterilization, that is tubectomy. One is an open method or a mini laparotomy. The other one is a laparoscopy. Now, mini laparotomy in many of the rural settings where laparoscopy is not available, usually they undergo what is called as puerperal sterilization, or immediately after the vaginal delivery, on the second or third day, the woman undergoes sterilization before getting discharged from the hospital. So they think that's the effective program to probably give them this permanent method of contraception. So there are other concerns wherein many women who have undergone this permanent method of sterilization, they in future, for some reasons or the other, whether it's social or sometimes they must have lost a child and they want to again plan a pregnancy, so they come to me to seek options for future fertility post tubectomy. So then we address two things. One is what is the woman's age and what is her egg reserve. That's very, very important for us to understand whether we have chances for what is called as tubal recanalization. That means whether this procedure can be reversed and these tubes can be joined together and again resume their fertility option, or they have to go to advanced reproductive techniques like IVF or ICSI. Now, the single most deciding factor whether they can go for either a tubal reversal procedure or an IVF procedure is totally based on woman's age and her egg reserve. If the woman is advanced in maternal age, say above 35, or if her egg reserve is decreasing, if she has decreased ovarian reserve, it will be prudent for the woman to directly proceed for IVF rather than wasting her time and decreasing her egg reserve further and compromising on her future fertility.
All right. I think this has been great, doctor. The audiences will go back with lots and lots of valuable insights. So thank you for sharing with us and thank you for joining us today.
Thank you. It was a pleasure. Thank you so much.
Thanks a lot.